that basic research does not have to be basic in the simplest sense of the word. It is something that we want you all to redefine to make it more attuned and relevant to the needs of our time.
What is important to emphasize is that these vaccines have been proven to be safe in large phase 3 multi-country clinical trials involving tens of thousands of humans. Adverse events are expected, as with all vaccines and drugs, and severe adverse events as a result of being vaccinated are very rare relative to the total population given the vaccines. And severe adverse events have been reported in only a few persons who have been given the vaccines. Vaccine hesitancy is high in the Philippines, and many Filipinos are not yet fully convinced of getting themselves vaccinated. So what really are the benefits of getting vaccinated?
The COVID-19 vaccines have been proven in large clinical trials to produce protection against the disease. This protection is a result of our bodies developing an immune response to the SARS-CoV-2 virus. If you have developed immunity through vaccination by any of the EUA-approved COVID-19 vaccines, this means that you have reduced risk of developing the illness, and most importantly, you are protected from severe illness and death. This immunity helps you fight the virus if you are exposed. Getting vaccinated may help protect people around you, such as your coworkers or family, because if you are protected from getting infected and from developing symptoms of the disease, then you are less likely to infect someone else. It is also important to stress that you get vaccinated with whatever vaccine is available. Doing so will lessen your chances of getting infected and getting the severe form of the disease. Real-world effectiveness trials have also shown a much higher protection compared to the protection reported in the phase 3 clinical trials. So hopefully, we have now convinced you of getting vaccinated. An important part of vaccination campaigns is herd immunity. But what exactly is herd immunity?
When someone is given any of the EUA-approved COVID vaccines, they are very likely to be protected against being infected. But not everyone can be vaccinated. Some people with health conditions such as HIV or cancer, or those health conditions which weaken their immune systems, or those who have severe allergies to some vaccine components may not be able to get vaccinated with certain vaccines. These vulnerable people can still be protected if they live in and amongst others who are vaccinated, since the vaccinated persons around them would form sort of a wall or a barrier which will protect the vulnerable members of the community from being infected. When a lot of people in a community are vaccinated, the pathogen has a hard time circulating because most of the people it encounters are immune. Thus, it cannot efficiently spread and be transmitted. So the more that others are vaccinated, the less likely people who are unable to be protected by vaccines are at risk of being exposed to the harmful pathogens. This is herd immunity. No single COVID-19 vaccine currently available provides 100% protection, and herd immunity does not provide full protection to those who cannot safely be vaccinated. But with herd immunity, these vulnerable people in the population will have substantial protection, thanks to those around them being vaccinated. Vaccinating not only protects yourself, but also protects those in the community who are unable to be vaccinated. Again, it is very important to get vaccinated with whatever vaccine is available. The more people that are vaccinated, the faster we can go back to our routines before the pandemic. Now that you have received the COVID vaccine, can we stop implementing non-pharmaceutical interventions and precautions such as wearing of masks or social distancing after being vaccinated?
Vaccination protects you from getting seriously ill and dying from COVID-19. For the first 14 days after getting vaccinated, you do not have significant levels of protection, since your body is still just learning to recognize the virus, after which it increases gradually. For a single-dose vaccine, immunity will generally occur 2 weeks after vaccination. For 2-dose vaccines, both doses are needed to achieve protective levels of immunity, which is usually attainable by 3rd week after the 2nd dose. Thus, it is important to complete the required number of vaccine doses and to come back for your succeeding vaccine doses on the date specified by your healthcare provider. While the COVID-19 vaccine will protect you from serious illness and death, we still don't know the extent to which it keeps you from being infected and passing the virus on to others. Initial studies suggest that vaccination decreases the viral load significantly, leading to less viral particles leaving the body, thus decreasing the risk of infecting others. However, to help keep others safe, especially the vulnerable, continue to practice minimum public health standards, maintain using masks, and keep at least a meter distance from others. Limit time in enclosed, crowded, or poorly ventilated spaces. Always follow guidance from your local authorities based on the situation and risk where you live.
We have invited today a guest speaker who will talk to us more about vaccination. Dr. MELVIN SENICAS is a physician-scientist with over 10 years of international experience in clinical research and development, scientific and regulatory affairs, and program management of vaccine development in the Asia-Pacific, Europe, Latin America, and Africa. He's a Bill and Melinda Gates Global Health Fellow and a global thought leader supporting the United Nations and the World Health Organization to directly counter fake news. He's a global medical director for Takeda, a TED educator, and digital health expert for the WHO. He's also a fellow of the Royal Society of Tropical Medicine and Hygiene and Royal Society for Public Health. Good morning, Dr. SENICAS. We're honored to have you here today. And thank you for accepting our invitation to be our guest speaker in this program. As the vaccination campaign picks up speed here in the Philippines, we have been seeing increasing cases of breakthrough infections among vaccinated individuals. Can you define breakthrough infections and how they can affect our ability to achieve herd immunity?
Breakthrough infection is a case of COVID in a vaccinated individual after getting full dose of the COVID vaccine. But because the vaccine requires about 2 weeks to become effective after the 2nd dose, for a 2-dose regimen of a vaccine, a person is not considered fully vaccinated until 2 weeks.
Natuklasan mo na ba ang bisa at benepisyo ng magkasamang herbs at superfoods? Tumutulong sila upang palakasin ang ating katawan at ang ating immune system para makarecover at makalaban sa mga karamdaman. Natagpuan mo na ba ang health supplements na kayang gawin ang parehong benepisyong ito? Introducing Health Insight Wellness Healthy Blend 15-in-1 and 16-in-1 coffee blend blended with Agaricus blazei muril at Cordyceps sinensis. Tinaguriang the king and queen of mushrooms. Taglay nito ang mga beta-glucans na siyang pinakapagkain ng immune system na lumalaban sa mga viruses, bacteria at cancer cells sa katawan. Ayon sa pag-aaral, nakakatulong din ang mga ito sa mga karamdaman gaya ng fatigue, pananamlay sa sex, heart, lung, and kidney diseases. Chlorella, spirulina, barley, moringa at chia seed, mga kilalang superfoods sa buong mundo. Nagsisilbi itong pagkain ng mga selula ng ating katawan para lumakas at makarecover ito mula sa panghihina at anumang karamdaman. Dahil sa taglay nitong chlorophyll, mahusay itong mga blood cleansers at nakakatulong para maiwasan ng anemia, sakit ng ulo, hypertension at diabetes. At marami pang ibang karamdaman dulot ng pagbaba ng blood oxygen sa dugo. Mangosteen, graviola at resveratrol, mga kilalang antioxidants. Tumutulong ang mga ito para bumagal ang aging process ng katawan. Pinagaganda nito ang functions ng nervous, circulatory at immune systems para lumakas laban sa tumor cells, maiwasan ang stroke at heart attack na resulta ng pagbabara ng mga ugat at paninigas ng mga muscle at body tissues dala ng acidity sa dugo. Aloe vera, brown seaweeds at stevia, mga pagkaing tumutulong para pagandahin ang ating digestive function, tumutulong gawing regular ang ating bowel movement, balansehin ang ating blood sugar level at pabilisin ang paggaling ng mga sugat sa katawan laban sa oxidative stress na nagiging sanhi ng iba't iba pang karamdaman. Ang Health Insight 15-in-1 and Health Insight 16-in-1 Herbal Coffee Blend ang dalawa sa pinakabasarap at pinaka-maaasahang herbal coffee blend na kaagapay at minahal ng masa. Huwag nang magpahuli. Subukan at patunayan ang nakakabilib na epekto ng Amazing Health Insight 15-in-1 and Health Insight 16-in-1 Herbal Coffee Blend. Ang dalawa sa pinakamasarap at pinakamamahal na herbal coffee mix ng mga Pilipino.